class. Over the past several weeks, our class has developed an increasing awareness of how evidence-based practice, or EBP, impacts the overall quality of patient care. A desire to improve patient outcomes through research is what continues to give our society the means to treat patients with advanced medical practices. With that being said, identifying evidence-based research that could be useful in clinical practice can be a daunting task. In fact, this hesitancy has the potential to steer healthcare workers away from implementing any type of evidence-based research within their practice. According to an article within the Clinical Journal of Oncology Nursing, a lack of EBP knowledge, skills, self-efficacy, and competency is a persistent barrier to fully implementing EBP into nursing practice. Because of these deterring factors, several models have become available for healthcare providers. These models provide a guide for healthcare professionals to utilize in order to understand evidence-based research and how certain research studies could be beneficial if implemented within care practices. This discussion will focus specifically on the Stetler model of research utilization to facilitate evidence-based practice, along with a brief history, its importance within healthcare, and implications of use for this model in clinical practice. According to our textbook, Burns and Groves, The Practice of Nursing Research, the initial design for the Stetler model was created in 1976 by Stetler and Merriam, with addendums later on in 1994, 2001, and 2010. The Stetler model offers guidance for healthcare professionals when integrating evidence-based practice into patient treatment. The Practice of Nursing Research textbook offers additional information regarding the Stetler model and highlights its 5 phases, which are preparation, validation, comparative evaluation and decision-making, translation and application, and evaluation. Phase 1 of the 2010 Stetler model is preparation. This phase includes identification of the purpose of a research study, origin of the problem, and selection of sources to assist in additional research. Phase 2 is validation, in which the research materials are evaluated for credibility and discarded if found to be inconclusive. Phase 3 is comparative evaluation and decision-making. During this phase, the healthcare professional must answer the following 4 questions. Number 1, does the evidence-based research seem like something that could be implemented into your healthcare setting? Number 2, is it feasible to utilize the research findings after consideration of potential risks, resources needed, and readiness of the individuals involved? Phase 4 is translation and application. This phase involves the introduction of a new healthcare practice to the team. Prior to implementation, the worker must assess the situation that is going to be changed, develop a plan for change, and implement the plan. Implementing change can be very difficult, which is why it's important to offer things such as workshops for the workers to familiarize themselves with the change, develop and disperse educational materials, and actively listen to any concerns that may arise. Finally, phase 5 is evaluation, which follows up on whatever EBP was set into action. Evaluation can involve anything from interviewing patients, speaking with involved healthcare team members, and/or conducting case studies for progress tracking purposes. In my current practice area, I can see how the Stetler model could be of use when implementing evidence-based practice. As a primary care office, I do not feel as though evidence-based practice is as high priority, especially in lower populated regions. It would be of use to identify an area of concern or need for improvement so that progressive change could be made. A committee could be formed to collect research articles and highlight key findings, then present those findings to the committee and the CEO. As mentioned, if a problem is never addressed, there will never be change. Thank you.